regarding the Disability Lifeline program. This is a program that in our county alone has provided medical care and a small stipend for about 2,000 people in our community who are disabled and who do not yet have the ability to get Social Security income. So we've created such a sort of a bridge for these folks as we try to help them move into the Social Security system and provide them the basic services so they can stay alive and maybe even have their health care improve. That system did change. We did have a reform in that system last year. Previously it had been a cash grant, and then years ago we added to the cash grant some medical care. So some services, some enriched services around that. Last year we shifted to a medical program with some enriched services around the medical care. We had about 18,000 people on the program. When it changed on November 1st, we dropped to about 13,500. So right off the turn of the clock, we lost a good percentage of the people who did not then come back for medical care, and we are trying to find them and get them back engaged in the system. We also have been providing a cash grant, and that shifted then to a community-based assistance program in Tacoma. Tell me, Roberta, who the contractors are in Tacoma.
Well, Sharon Care House
Sharon Care House
MDC provides a housing assistance, and then there's some hygiene items and transportation items that actually our agency provides.
through South Outreach.
Yeah.
So we do have a couple of agencies, so if the person is homeless or if they need to have assistance in staying in the home that they're in, they can go to those two organizations and get assistance. But we lost, after that cash grant went away, we had very few of those folks actually make it to those agencies to get that support. So now we're 3 months, 4 months into this program, and we're trying to figure out ways to make sure that we know that those folks are safe and that they're receiving some care. So we're doing a lot more outreach, and you can help us do that to try and make sure that people know that there is support for them. If they go to one of the community clinics, they can get support through that. Even if they went to an emergency room, they can get support to try and get onto the medical program. And but the housing support system, that's then a referral from the medical provider. So that's where we're sort of losing a little bit of touch with those folks. I'm very, very concerned about this. This has been a program that I've been very engaged in over the years, and saw the benefits definitely of this program. And it's heartbreaking to see that we may have lost so many people in the system. So
I would just add on while the next person is coming up that